Hey everyone, welcome back for another deep dive. As eye doctors, we're always thinking about ways to protect our patients' vision.
Absolutely.
And today we're going to be focusing on something that's super relevant to that, the impact of something you might not think too much about.
Hmm. Okay. I'm intrigued. Lay it on me.
The impact of systemic antihypertensive medications. Those meds that lots of our patients are taking for high blood pressure,
Okay. Yeah, that makes sense.
on their intraocular pressure and their risk of developing glaucoma.
Okay. Yeah, that's a great topic for a deep dive. And, while we often focus on topical treatments for glaucoma, the influence of these common medications that patients are taking for completely different conditions
Right.
might surprise you.
Yeah, I think we're going to uncover some really interesting insights today.
Yeah.
So to kind of set the stage, we're diving into a recent systematic review and meta-analysis
Okay.
that examines this very topic.
Mm.
And the researchers really wanted to get to the bottom of whether there's a link
Yeah.
between taking these medications for high blood pressure and a patient's IOP or their chances of developing glaucoma.
Makes sense. So did they look at all the different types of blood pressure meds?
They did, yeah. They honed in on 5 main classes of antihypertensive medications:
Okay.
beta blockers, calcium channel blockers,
Right.
angiotensin-converting enzyme inhibitors, or ACE inhibitors for short,
Got it.
angiotensin receptor blockers, the ARBs,
Yep.
and diuretics. So a pretty comprehensive look at the most commonly prescribed meds for hypertension.
Absolutely. And what's really fascinating here is that the researchers didn't just rely on one single study. They took a meta-analysis approach,
Yeah.
which means they pulled data from a whole bunch of different studies.
Yeah, 11 to be exact, which is a lot.
Yeah, that is.
And get this, over 249,000 participants.
Wow. That's a massive amount of data.
Huge, yeah. It's like a super study.
Yeah.
And that really gives the findings a lot more weight than any single study ever could. So we can be pretty confident in the results they came up with.
Right, exactly. When you've got that many people involved, it really strengthens the evidence.
Totally.
Right.
So they had all this data, and they were mainly interested in 2 key things.
Okay.
First, they looked at the actual IOP measurements of the patients taking these different medications.
Right.
And second, they wanted to see if there was any connection between the medications and whether or not the patients developed glaucoma.
Okay. So they're looking at both the direct effect on eye pressure and the long-term risk of developing glaucoma. That makes sense.
Exactly. So let's get to the good stuff. What did they find? What kind of connections did they uncover? I'm ready for some surprises.
Well, some of the findings were pretty much what you might expect, but others were a bit more unexpected.
Okay, I like where this is going.
For example, let's start with beta blockers.
Nah.
The analysis found a connection between beta blockers and both lower IOP and a lower risk of developing glaucoma.
Okay, that's kind of what I was expecting.
Yeah. And there was even one study that showed that the longer someone was taking beta blockers, the lower their glaucoma risk seemed to be.
Oh, wow. So it's not just a correlation. It suggests that maybe there's a protective effect that actually gets stronger over time.
Exactly. And that's a pretty important piece of information, especially for our listeners who are treating patients with both high blood pressure and glaucoma.
Totally. It's like a 2-for-1 benefit. You're managing the blood pressure and potentially reducing the risk of glaucoma at the same time.
Right.
But let's not get ahead of ourselves. We've still got a lot more to uncover. What about the other medications they looked at? Any other interesting findings?
Well, the results for calcium channel blockers, those were a little bit of a curveball.
Oh, okay. Tell me more.
They were associated with a higher risk of glaucoma.
Really?
But here's the thing. There wasn't a corresponding increase in IOP.
Wait, so they're linked to a higher risk of glaucoma, but they don't seem to affect IOP. That's not what I would have guessed.
Yeah, it is a bit counterintuitive, isn't it?
Definitely. It makes you wonder if there's something else going on, some other mechanism that's independent of IOP.
Yeah, there's got to be more to the story.
Okay, so we've got this interesting situation
Right.
where one class of blood pressure medications, the beta blockers,
Mm-hmm.
seems to be linked with a lower risk of glaucoma,
Mm-hmm.
and another, the calcium channel blockers, seems to be linked to a higher risk. But what about the other classes of medications they looked at? ACE inhibitors, ARBs, and diuretics.
Yeah, those are interesting.
Did they find any connection to IOP or glaucoma risk with those?
It's kind of surprising, but those 3 ACE inhibitors, ARBs, and diuretics, they didn't show any consistent links to either higher or lower IOP or glaucoma risk.
Huh.
So
Okay.
it seems like the effects, at least from what they saw in this analysis, are really specific to beta blockers and calcium channel blockers.
That's fascinating. You know, it's funny, as eye doctors, we're constantly thinking about IOP
Of course.
and how different things can affect it.
Right.
But I don't know about you, but I don't always stop to think about those systemic medications
Yeah.
that our patients might be taking for other conditions.
No, you're right. It's not always top of mind.
It really makes you realize how interconnected different areas of medicine are.
Absolutely. And this study is a perfect example of that.
Definitely. So I think it's worth taking a closer look at what might be going on here.
Yeah.
You know, the potential mechanisms at play.
Right.
For example, with beta blockers, it's thought that they work by blocking certain receptors in the eye,
Okay.
which leads to a reduction in aqueous humor production.
Right. Which then obviously leads to lower IOP.
Exactly. Less aqueous humor, lower IOP. Seems pretty straightforward.
Yeah, makes sense.
But what about calcium channel blockers?
Yeah.
How could they be linked to a higher risk of glaucoma if they don't seem to affect IOP? That's the part I'm still trying to wrap my head around.
Well, the researchers think that there might be other mechanisms involved,
Okay.
things that are independent of IOP. One possibility is that they might affect blood flow within the eye
Interesting.
in a way that could increase glaucoma risk even if the IOP stays the same.
Yeah.
But to be honest, we need more research to really understand what's going on there.
It's a bit of a mystery then, at least for now.
Yeah, for now.
It definitely raises more questions than answers.
Yeah,
And highlights the need for further investigation
totally.
into this particular finding. But even with those unanswered questions, I still think this meta-analysis gives us some pretty valuable insights, wouldn't you say?
I completely agree. It's giving us a much clearer picture of how these common medications that we prescribe all the time,
Mhm.
especially for high blood pressure, can potentially affect our patients' eye health.
Yeah.
And, it's a good reminder that we, as eye care professionals, we really need to be aware of these potential connections,
Yeah.
even if we're not the ones actually prescribing these medications.
It's about taking a more holistic approach to patient care, wouldn't you say?
100%. We need to consider the whole patient,
Right.
their entire medical history, not just their eye health in isolation.
Yeah, and how all those different pieces of the puzzle might be fitting together.
Right. Exactly.
But before we get too carried away
Yeah.
and start changing everything we do in our practice based on these findings,
No.
I think it's important to be realistic about this meta-analysis.
Okay.
No study is perfect.
Of course not.
There are always things to keep in mind.
Right. There are always limitations.
So what are some of the caveats here?
Well, one of the biggest ones is that this was a meta-analysis of observational studies,
Okay.
not randomized controlled trials.
Okay, so that means we can see that there are connections between certain medications and certain outcomes.
Exactly.
But we can't definitively say that one is causing the other.
Right. That's the key difference.
So while we're seeing these interesting links between beta blockers and a reduced risk of glaucoma
Yeah.
and calcium channel blockers and a potential increase in risk, we can't definitively say
Yeah.
that taking these medications is actually directly causing those effects.
That's right. There could be other factors involved that we just don't know about.
Okay, so that's something to keep in mind. It's a great starting point, this meta-analysis, but we really do need more research
Absolutely. We need those randomized controlled trials.
or give us more definitive answers.
to really nail down those cause and effect relationships.
Exactly. What other limitations should we be aware of?
Well, another one is that the way glaucoma was defined
Okay.
and diagnosed
Right.
varied across the different studies they included in the analysis.
Oh, okay, so that makes it harder to compare the results.
Right, it does. Some studies used clinical examinations, which are generally thought to be pretty reliable,
Yeah.
while others relied on diagnostic codes from medical records,
Okay.
which, can be a little bit less precise.
Right, so we're not comparing apples to apples necessarily.
Exactly. And that makes it tough to really know for sure if the findings are consistent across the board.
It sounds like we need more standardized methods for diagnosing and tracking glaucoma, wouldn't you say?
Absolutely. If everyone was on the same page, it would really strengthen future research in this area.
And make it easier to get clear answers.
Exactly.
Yeah.
Okay, well, there's also the fact that the way they tracked medication use varied between the studies.
Yeah.
Some use prescription data, which is probably pretty accurate.
Yeah.
But others relied on patients remembering and reporting what they took.
Right, and that can be a bit unreliable.
It can be, yeah. People don't always remember exactly what medications they took or how long they took them for.
So we've got some potential inaccuracies in both the glaucoma diagnoses
Yeah,
and the medication used data.
that's right.
It really highlights the need for more rigorous methods in future research.
Definitely. The researchers actually talked about these limitations in their paper.
Oh.
And they totally agree that we need more investigation, especially randomized controlled trials.
Right, to back up what they found and really clarify the mechanisms at play.
Yeah, that's the next step.
Okay, so it sounds like we need to take these findings with a grain of salt,
Mm,
or maybe a drop of saline, to stay on theme.
nice.
But even with all that said, I still think this meta-analysis offers some really useful insights, don't you?
Oh, absolutely. It's shining a light on the potential impact that those systemic medications can have
Right.
on a patient's eye health. And that's something that all of us as eye care professionals need to be thinking about.
Right. We can't just focus on the eye itself. We need to take a step back and look at the bigger picture.
Exactly. The whole patient and all the things that might be affecting their eye health.
Yeah. So how do we translate all this into what we do day to day in our practice?
That's the million-dollar question, right?
It is, yeah. Should we be changing how we manage patients with high blood pressure and glaucoma? Or are we just waiting for more research before making any big decisions?
That's a really good question. I think in the final part of our deep dive, we should take a look at what this all means for how we approach patient care.
Sounds good to me. I'm curious to hear your thoughts. Welcome back, everyone, for this last part of our deep dive. We've been talking about this really interesting study that's found some connections between certain blood pressure medications and a patient's risk of developing glaucoma.
It's pretty eye-opening stuff, right?
It is, yeah. No pun intended.
Well, maybe a little intended.
So now that we've got all this new information, I'm sure many of you are wondering what to do with it.
Yeah, how does this actually change what we do in our practice?
Exactly. Should we be bringing this up with our patients? Should it change how we manage those with both high blood pressure and glaucoma?
Right, those are the big questions.
What are some of the key takeaways for our listeners? How can we actually put this research into practice?
Well, I think the main thing to remember is that this meta-analysis, it's really valuable,
Yeah.
but it's just one piece of the puzzle. We need to look at the whole patient when we're making decisions about their care.
So it's not just about their eyes,
Right, it's about their overall health, too.
their whole medical history.
Exactly.
So what does that mean, practically speaking?
Well, for one thing, it really highlights how important it is to take a good medical history.
Okay.
We should be asking our patients about all the medications they're taking,
Yeah.
even over-the-counter stuff and supplements, and we need to be really careful about potential interactions, especially with their glaucoma treatments.
Right. It all comes back to the basics.
It
But
does.
those basics are so important.
Couldn't agree more. And this is especially true for patients taking those antihypertensives. We need to know exactly what class of medication they're on, how much they're taking, and how long they've been taking it for.
Yeah, that all makes sense.
Because that information can give us a much better idea of their risk for glaucoma.
Okay, so for example, let's say we have a patient with hypertension who's also taking a beta blocker. Their IOP is looking good, nice and controlled.
Yep.
We might be tempted to think, great, everything's fine. But this study suggests that maybe we need to be a little more cautious.
I think that's a good point. The beta blocker could actually be masking some early signs of glaucoma.
Oh, okay, by lowering their IOP.
Exactly. So even if their pressure looks good on paper, we still need to watch them carefully
Okay.
for any changes in their visual field, their optic nerve, or anything else that might suggest glaucoma is progressing.
So more frequent eye exams,
Mm.
earlier visual field testing,
Yeah, I think those are good options.
be a bit more proactive.
Exactly. Early detection is key with glaucoma. We don't want to get caught off guard.
What about those patients on calcium channel blockers? How should we approach those cases?
Oh,
Especially given that finding of an increased risk of glaucoma.
yeah, that's a tricky one. I think the key here is awareness and close monitoring.
Okay.
Just because someone is on a calcium channel blocker doesn't automatically mean they'll develop glaucoma. But we do need to be extra careful, especially if they have other risk factors.
Like a family history glaucoma,
Right.
high IOP,
Uh-huh.
thin corneas.
Yep. All of those things.
So, more follow-up visits. Lower threshold for starting treatment.
Yeah, I think that's a reasonable approach. And, it might even be worth talking to their primary care physician
Oh, that's a great point.
about the potential risks and benefits of maybe switching to a different type of blood pressure medication.
Especially if they have those other risk factors we talked about.
Exactly.
It really highlights the importance of good communication
Absolutely.
between eye doctors and primary care physicians.
I mean, traditionally, those two fields haven't always worked that closely together.
Right, they've kind of been in their own lanes.
But this research shows us just how important it is to collaborate.
It's all about the patient in the end, right?
Right.
Making sure they're getting the best possible care.
And sometimes that means sharing information and working together as a team.
I think that's one of the biggest takeaways from this whole discussion. It's not enough to just look at the eye in isolation.
Nope, we've got to zoom out and see the whole picture.
Think about the patient's overall health
How everything is connected.
and how those connections can impact their vision.
Exactly. And this study is a perfect example of that. It's really changed the way I think about managing my patients.
Me too. I'm definitely going to be more mindful of those systemic medications from now on.
I think we all will. I hope our listeners will too. It's been a great discussion. Thanks for joining us for this deep dive. We hope you found it informative.
And maybe even a little bit challenging.
Yeah, it definitely got us thinking.
And that's what it's all about, right?
Absolutely. The more we learn, the better equipped we are to take care of our patients.
And at the end of the day, that's what really matters.
Couldn't have said it better myself.